Your doctor told you your prostate symptoms are just aging. They were wrong. I'm Dr. Adriana Wells, board-certified urologist and prostate health specialist, and after treating thousands of men over 60, I can tell you with complete certainty what is silently destroying your prostate right now is not your age. It is 3 specific foods sitting in your kitchen, foods you eat every single day, because you believe they are healthy. Stay right there, because what I am about to show you will completely change how you think about prostate health and possibly reverse symptoms you were told could never improve. But before I get into that, if you are new here, subscribe to Urology for You and hit the bell. I post evidence-based guidance every week that your doctor does not have time to tell you. You need this channel. Now let us get into it. Now, I want you to think about something. Are you a man over 60, waking up 2, 3, maybe 4 times a night just to urinate? Is your stream weaker than it used to be? Do you feel that pressure, that urgency, that frustrating feeling that your bladder never fully empties? If yes, then what I am about to share with you today could change the course of your prostate health for good. Because here is the truth most men never hear. Some of the foods you have been eating faithfully, the ones marketed as healthy, heart-smart, even prostate-friendly, may actually be fueling silent inflammation inside your prostate every single day. Not fast, not dramatic, but slowly, quietly, relentlessly. I have spent over 2 decades treating men struggling with prostate enlargement, rising PSA levels, nighttime urination, weak urinary flow, and the constant anxiety of not knowing whether things will keep getting worse. And I see a pattern, again and again, men who follow mainstream nutritional advice religiously, men who eat what they believe is a healthy aging diet, men who avoid junk food, take supplements, and do everything right, yet their prostate continues to enlarge, their symptoms progress, their quality of life steadily declines, and eventually they sit across from me and ask a question that stops them in their tracks. Doctor, could the foods I am eating to protect my health actually be harming my prostate? That question is the reason for today's video. If you have ever asked yourself that same question, drop the word prostate in the comments right now. I read every single one, and it tells me exactly who needs this information most. The most damaging foods for prostate health in men over 60 are not burgers, they are not fries, they are not sugary sodas, they are foods praised by health organizations, foods recommended by nutrition experts, foods marketed as protective. And the danger is not immediate. It is cumulative. These foods contain compounds that in aging male physiology can trigger chronic prostate inflammation, promote abnormal tissue growth, disrupt hormonal balance, and accelerate benign prostatic hyperplasia. The result is worsening urinary symptoms that are then treated with medications or procedures without ever addressing the underlying trigger. Let me be very clear, this is not about fear. It is about physiology. As men age, several biological shifts occur. Testosterone gradually declines. Estrogen activity becomes relatively stronger. Inflammatory responses increase. Tissue repair becomes less efficient. This makes the prostate far more sensitive to dietary signals than it was at 30 or 40. A food that is neutral or even beneficial earlier in life can become harmful decades later. This is the context mainstream nutrition advice almost never addresses. I am going to walk you through 3 foods that I consistently see linked to prostate inflammation and enlargement in men over 60. And I want you to stay with me because the third one is the one most men are consuming multiple times a day without even realizing it. Food number 1, soy products, tofu, soy milk, edamame, soy protein powders. Soy is often promoted as a smart choice for aging men, especially for heart health and cholesterol. But here is the physiological problem. Soy contains isoflavones, plant compounds that act as phytoestrogens, meaning they can bind to estrogen receptors in the body. In younger men with robust testosterone levels, this effect may be minimal, But in men over 60, where testosterone is already lower and estrogen activity is relatively higher, adding dietary estrogen-like compounds can create an imbalanced hormonal environment inside the prostate. Why does this matter? Because estrogen signaling in prostate tissue is strongly associated with increased cell proliferation, inflammatory signaling, and glandular enlargement. In my clinical practice, men who consume soy regularly often present with more pronounced urinary symptoms over time. The prostate does not respond well to chronic estrogenic stimulation, especially in aging tissue. This does not mean soy is toxic. It means context matters, and the aging male prostate is a very specific context. Are you currently consuming soy milk, tofu, or soy protein? Tell me in the comments. I want to know how many men watching this are dealing with this exact trigger right now. Food number 2. Dairy. Consume daily for bone health. Milk, cheese, yogurt. Dairy is deeply ingrained in nutritional advice for older adults, largely due to its calcium and protein content. But here is what most men are never told. Dairy naturally contains growth-promoting hormones, including IGF-1. Insulin-like growth factor 1. IGF-1 plays a vital role in childhood growth, but in aging men, it has a darker side. IGF-1 stimulates cell division, and tissues already prone to enlargement, like the prostate, are particularly responsive. When dairy is consumed multiple times per day, IGF-1 exposure remains chronically elevated. Additionally, high calcium intake from dairy can interfere with vitamin D activation, a nutrient essential for regulating prostate cell growth and immune balance. The result is a biological environment that favors enlargement rather than regulation. Again, this is not about demonizing dairy. It is about recognizing that what supports your bones may not support your prostate when consumed excessively. Food number 3. Omega-6 heavy vegetable oils, corn oil, soybean oil, sunflower oil, safflower oil. These oils are widely promoted as heart-healthy alternatives to saturated fat. But here's the problem. They are extremely high in omega-6 fatty acids, which are pro-inflammatory when consumed in excess. The modern diet already delivers omega-6 at ratios far beyond what the human body evolved to handle, and the prostate is especially sensitive to inflammatory signaling because of its dense fatty acid receptor activity. When omega-6 intake overwhelms omega-3 intake, the body produces inflammatory compounds that increase prostate swelling, intensify urinary urgency, narrow the urethral channel, and worsen BPH symptoms. Many men do not realize they are consuming these oils multiple times a day, not just at home, but in restaurants, packaged foods, and even foods labeled as healthy snacks. Which of these 3 foods are you consuming right now? Soy, dairy, or vegetable oils? Drop your answer in the comments. 1, 2, or 3. Let me see exactly where most men are being exposed. Now let me tell you about a patient I saw not long ago. Late 60s. Followed every piece of nutritional advice he had ever been given. Soy milk every morning, yogurt every day, tofu several nights a week, vegetable oil for all his cooking. He was waking up 5 times a night. His PSA was rising steadily, his prostate was enlarging, and he was exhausted, not just from the sleepless nights, but from doing everything right and still getting worse. We made one change: dietary elimination of these 3 triggers. No new medications, no procedures, no dramatic interventions. Within weeks, his nighttime urination improved. Over the following months, objective markers followed. This pattern is not rare. I see versions of this story regularly because the trigger is often hiding in plain sight. Now, I want you to know the warning signs to watch for, because prostate inflammation rarely announces itself loudly. It builds slowly, and men often dismiss the early signs as simply getting older. But these are not signs of aging, these are signals. Increasing nighttime urination. If you are waking up more often now than you were a year ago, your prostate is likely inflamed and gradually enlarging. Weak or delayed urine stream. Difficulty starting urination is often caused by swelling around the urethra. Incomplete bladder emptying. That lingering pressure after urinating is a classic sign of obstruction from prostate enlargement and gradually rising PSA. While PSA has multiple influences, chronic inflammation is a major and often reversible contributor. These signs are not normal aging. They are signals, and they are often reversible when you address the right triggers. Removing harmful triggers is only half the equation. The other half is nourishment. Instead of soy, choose protein sources that do not interfere with hormonal balance. Wild-caught fish, grass-fed meats, pasture-raised poultry, plant proteins like pea, hemp, or rice. Instead of daily dairy, calcium can be obtained safely from leafy green vegetables, sardines with bones, fortified non-dairy milks, and targeted supplementation if needed. Instead of omega-6 oils, use fats that reduce inflammation. Extra virgin olive oil, avocado oil, and increase omega-3 intake through fatty fish and high-quality fish oil supplements. This dietary shift alone often leads to noticeable improvement within 6 to 8 weeks. Once inflammatory triggers are removed, the prostate has an incredible ability to recover. But healing can be accelerated with specific nutrients that support circulation, hormonal balance, and tissue repair. For men seeking gentle support, nutrients that improve blood flow and reduce inflammation can help restore normal prostate function. For men with more advanced symptoms, comprehensive prostate-focused formulations may support improved urinary flow, reduced inflammation, better tissue oxygenation, and hormonal optimization. Always discuss supplementation with your healthcare provider, especially if you are monitoring PSA or managing existing conditions. If you are over 60 and experiencing prostate symptoms, eliminate soy, excessive dairy, and omega-6 oils for 90 days. Track your symptoms objectively. Monitor PSA and prostate size when appropriate. Focus on inflammation reduction, not just symptom suppression. Many men find this approach provides relief, comparable or superior to medication, without side effects. Your prostate is not failing you, it is responding to signals, many of them dietary. You do not have to accept worsening symptoms as inevitable. You do not have to wait for medications or procedures to define your future. With the right information, you can take control. If this video opened your eyes, type "eyes open" in the comments right now. Share this with one man over 60 in your life who needs to hear this. You might be saving someone from years of unnecessary suffering. If this video helped you, like it and subscribe to Urology for You. I am Dr. Adriana Wells, and I will see you in the next one.